Jim, we were talking about ureter injuries recently, but I imagine there are other areas of the anatomy that can get injured during a laparoscopic procedure.
Well, there can. As you and I have discussed before, the disadvantage to laparoscopy is that the surgeon's view is not as good as it would be if there was a big incision. This results in a number of different types of injuries. There can be a common bile duct injury during a gallbladder procedure. There can be a bowel perforation in any laparoscopic procedure because for any of us who have even studied the most elementary anatomy, the abdomen is full of bowel. So one of the first things the surgeon has to do is to try, number one, to move the bowel out of the way. There are a number of procedures, maneuvers to do that. The most simplistic one is to tilt the patient up towards his or her head using gravity to bring the bowel up towards the diaphragm. However, it doesn't completely remove the bowel from the abdomen, and so the surgeon has got to go to great lengths and take great pains to make sure that he does not perforate the bowel with the trocar being the surgical instrument that is used to go inside the abdomen. As you can well imagine, a bowel perforation during a laparoscopic procedure is a horrible injury for anybody to have.
And it's much worse than a ureter injury, is that right?
Well, it is because the ureter is simply transmitting or is a conduit for urine, which is largely water, to go from the kidney to the bladder.
A little more sterile.
Quite a bit more. The bowel obviously has food that is in various stages of being digested, lots of bacteria, lots of germs. It's just as simple as that. And when they spill out into the abdomen, our bodies are not designed to have that happen, and it will result in a life-threatening injury, life-threatening sickness. We've seen people who had to stay in the hospital for months to get over an unrecognized bowel perforation injury during laparoscopy.
How do they fix it?
Well, the first thing you hope is that the surgeon realizes he or she has caused the injury at the time. If they do, it's very easy to fix through the laparoscopic instruments that are right there. Usually can be done with little or no complication at all. If, however, the surgeon does not realize that he or she caused that injury, sends the patient off to their room. Some of these surgeries are same-day surgeries, so you end up sending your patient home. You get deathly ill, and the only way to fix it is to create a huge incision from the base of your rib cage to your pubic bone, open you up, thoroughly inspect the abdomen to find the hole. Once you find it, then you have to cut it out, repair the bowel that you leave behind, flush the abdomen out, and frequently, because of the nature of the infection, that incision can't be closed. So the patient ends up staying in the hospital for months while that incision heals from the inside out. It's just a horrible process. Sometimes, Emily, it results in death.
So time is of the essence in discovering those injuries.
Absolutely.
Okay. Thank you.
Mm-hmm.
For a free confidential consultation with one of our experienced injury attorneys, call our toll-free number or fill out a quick contact form today.